I'm Ross, the founder of WeKo. Firstly, I'd like to introduce you to Leslie and baby Brendan. Baby Brendan is suffering from an earache, so Leslie has booked an appointment at a local GP clinic. Although Leslie's been feeling quite down lately, she's been struggling to leave the house since Brendan was born. Arriving at the clinic on time, the pair are stuck in the waiting room. 20 minutes passes, and finally they're called in by Dr. Dixon, who quickly prescribes antibiotics and rushes the pair back out into the waiting room, all within 12 minutes. Leslie leaves feeling quite dissatisfied with that whole experience. Not to mention, Dr. Dixon didn't recognise that Leslie was suffering from postnatal depression, which if left undiagnosed, could lead to depression and pose long-term risks to both Leslie and her baby. Leslie is not alone. Many Australians, just like Leslie, are currently going undiagnosed in general practice. Look at these numbers. Millions of Aussies are suffering. Approximately 10% of the people in this room currently have a chronic disease that they are not even aware of. Now, this isn't the fault of any one doctor. Many doctors, just like Dr. Dixon, face the unfortunate conflict between delivering comprehensive patient care and the inherent time and financial pressures of general practice. The Australian government recognises this as a problem. They are offering extensive incentives to increase the rate of diagnosis and treatment of chronic diseases. But this just still isn't enough. People are slipping through the cracks. There's a simple solution. WeKo GP's secure digital platform. WeKo's user-friendly interface asks Leslie and Brendan some simple questions about their health prior to the consultation starting. WeKo's algorithms then seamlessly in real time deliver Dr. Dixon a clear agenda for that consultation, ensuring she understands Leslie's needs for that consultation and if there's any chronic disease risk. Using WeKo software, Dr. Dixon would have known that Leslie was suffering and could have supported her. We create value for all healthcare stakeholders. We empower patients. We help patients take control of their health by setting the agenda for that consultation, making it easier for GPs to meet the expectations of every single patient. We stop the suffering in silence. We proactively identify patients who are suffering from chronic diseases, making it easier for GPs to diagnose and treat, ensuring comprehensive care for every patient. We alleviate the time pressures. We do the GP's groundwork while the patient's in the waiting room, freeing up valuable time during that consultation for rapport and trust building. And research shows that it's this rapport and this trust that leads to patients following what the GP suggested as their treatment plan and leading to positive patient outcomes. And lastly, we add to the bottom line. We create revenue opportunities by delivering positive patient experiences and identifying undiagnosed chronic disease risks. But here's the great part. In the last couple of months, we've run a pilot, and we were able to proactively identify 3 Australians suffering from type 2 diabetes, and 2 people suffering in silence with mental health issues. This was such an amazing moment. This is when I knew the WeKo GP platform can have a massive impact on the lives of everyday Australians and make sure no one is suffering. And for the financial people in the room, in just 3 weeks, we were able to add over $1,200 to the clinic in revenue, additional revenue. So you might be sitting out there asking yourself, sounds amazing, is this actually sustainable? Yes, and best of all, it's free to the patients. We're using a B2B subscription model, and due to the extensive government incentives, we've calculated a 300% return on investment. But our vision isn't stopping here. Through the use of the platform, we'll be capturing key health data, which will be creating a chronic disease diagnostic tool to further support GPs in decision-making around chronic diseases. Now, this is a massive opportunity for us. With the uprise in telemedicine around the world, clinicians are searching, they need tools to support in their decision-making around chronic diseases. So to help us ensure comprehensive care for every single Australian, actually every patient around the world, we're looking for introductions to GP clinics so we can run our last phase of pilots. We're looking to raise $300,000 so we can take the key learnings from those pilots and onboard 20 clinics and capture key data from 10,000 patients. In the third stage, we're looking to raise an additional 1.2 million to scale and to create a chronic disease AI diagnostic tool and gain TGA approval, making us the first solution to the market, AI solution to the market, which supports GPs in decision making around chronic diseases. Together, we can ensure comprehensive care for every single patient around the world and make sure no one is suffering in silence. WeKo GP, simplified healthcare. Thank you.